There are several people who are very close to my heart who have cancer right now. I fully understand how my research can contribute to better outcomes for people who are ill. My name is Martine De Cock and I have been a computer science professor here at UW Tacoma since 2014. I hadn't really worked much on healthcare data before, but the first thing I noticed was how messy healthcare data is. It's held within research centers, within hospitals, within clinical sites, and it's very difficult to get patient-level data. There are a lot of laws and regulations.
Hospitals do not disclose their data to other hospitals unless they are in an agreement.
Generally, our goal is to make medical data available for people without risking patient safety.
We use a process called synthetic data generation. I think synthetic data is that bridge for the researchers where they can get insight into what the real data would look like without actually accessing the real data.
It doesn't capture patient information at the individual level, but it behaves statistically as the original data set.
You start from real data and you train an AI model, and then you use it to generate synthetic data. In the spring of 2024, we were one of the first 35 projects in the nation to get funded by the NAIR. NAIR is the National AI Research Resource.
Around 2 years ago, I saw her listed on a set of pilots with NAIR. I said, whatever you're building with synthetic data is whatever we need. My team as biomedical researchers have data that comes from participants and patients in rare disease community that is consented for doing this kind of research. She has a wonderful lab, very capable students, really experienced in developing the algorithms and also measuring privacy characteristics and metrics.
Without the students, I would not be able to do the work that I am doing now, and I'm very, very serious about that. The students are really the ones who make it happen.
What you're doing is important, and hopefully down the road it will affect real people, improve real people's lives.
With more researchers given access to this data, it can lead to more understanding of genomics, can lead to treatments.
It's just like you're adding a sliver of light to a massive amount of data that must be coming down to something in terms of output of research and then eventually cures.
We started with acute myeloid leukemia, and actually my father died from leukemia. Just having that personal component I think brings more meaning to whatever I'm doing, and kind of a good reminder that it is real data of real people.
If you were to go back to those patients that have donated their data, they had the hope that research done on it will be done as much as possible to advance the understanding of that disease that's being studied, and a lot of time that wish is not fulfilled. So it's kind of like a pact that we need to honor.
The technology that we are developing is creating a road to make that possible. I hope we can keep working and lead through some breakthroughs in AI so that we can use all the data to do social good.